Hey everybody, it's your favorite doctor here, Dr. Tiffany Butler, and welcome to my YouTube channel. And in this video, I'm going to be talking about lumbar spine dysfunction or lower back pain. Alright, so let me take out my spine. As always, I want to educate you on anatomy so you know what I'm talking about and all that good stuff. Alright, so the lumbar spine right here, so it is, I think it's like blue color. It's at the bottom, okay? The lumbar spine is between the thoracic spine, which is the mid-back. The mid-back is where your ribs connect to your spine, and the pelvic or sacrum area. All right, so sacrum is this base right here. It's like a blade. So the lumbar spine is has the largest spinal bones or vertebral bones in the spine, and they are meant to bear weight and load, okay? So there's 5 vertebrae right here. So let's look at it from the back. 5 vertebrae, 1, 2, 3, 4, 5. And as you can see, there is the disc, because I got some vertebrae that's removed. This is an old model, but this is the disc. The disc is, again, is the spongy like tissue made of cartilage, and this is what gives you your height. And it's in between each vertebrae right there, okay? And there's cartilage. All right, that's the white stuff. And this, of course, is the spinal nerves. This is the spinal cord, and this beautiful thing here is your muscles. So this particular muscle is called the iliopsoas muscle, and this muscle connects to, as you can see, directly to the vertebral body of the lumbar spine, and it connects to the femur, okay, the femoral head. Now, that muscle, if it is tight, it will actually cause you to have not only lower back pain, but hip pain as well. So what are some of the causes of lower back pain? One of the main things is trauma. So it could be a macro trauma or micro trauma. Remember, macro trauma is like a slip, fall, car accident, playing sports or anything like that, running, you jumping, jogging, working out. All right. A micro trauma would be something you do repetitively, very small, but over a period of time it causes you to have pain and discomfort. And that would be if you have a job where you sit most of the day. All right. So if you do any type of administrative things, if you are a driver, taxi driver, truck driver, bus driver, you can also have lower, pain in the lower back because of that. Now, the other thing would be pathology. That would be disease. Okay, it could be disease of the bones itself. All right, so the bones or the joints. And the most common I've seen over the years of practicing is osteoarthritis or spondylosis. You see these terms. If you ever look at your X-ray report, you don't know what it's talking about. But that's basically degeneration of the spine. You also have something called degenerative disc disease, where the disc, that spongy-like tissue, becomes dehydrated. And because it is cartilage, it does not regenerate itself. It really has poor blood supply because it doesn't have arteries that go directly to the vertebral bodies, but it gets its oxygen and nutrients through the capillaries. So it's very slow in terms of healing. And like I said, like the cartilage in your body, it does not come back once it is damaged. All right. Trying to think, what are some other things that can cause lower back pain? I don't have my cheat sheet. So those are the most common things. Like I said, trauma, pathology, and trauma, pathology, disease, and abnormal posture. All right, so if you're a sloucher, if you sit and you're sort of like, you can't see me, and you sort of like slouching your chair, I'll put a picture up so you can see it. That can cause lower back pain. If you are a person that does repetitive movement throughout the day, especially lifting and then twisting. So if you're a warehouse worker, Amazon worker, UPS worker, FedEx worker, and you're in the warehouse and you're on concrete floor, you're guaranteed going to experience some type of back pain and or discomfort. Being overweight and obese. All right, this is huge because I read the most recent article that said about 50, was it at the high end, 50% of adults in the United States are overweight and obese, and that is horrible. Well, it makes sense with the disease, the things that's killing us, because it's directly related to our diet and our lifestyle, which is heart disease. Heart disease is the #1 killer of adults in the United States, and it's largely due to our diet. So if you are overweight or obese, more than likely you have back pain. Now, your back pain may not occur right away, as your body sort of gradually adapts to it, and after a while it's like, okay, it's too much, so it begins to feel, and you start to have pain. All right, so I'll give some images up so I can explain this point I'm about to make right now. So the reason why you start to experience back pain when you are overweight or obese, because your spine is designed to be in a certain type of position to be able to bear weight, load, from gravity and from the forces that come from the ground where you're walking and where you're sitting. As the weight begins to pull forward in your abdomen, guess what? It pulls the spine with it. So now the spine doesn't have a normal curve in the lower back. It's accentuated. And a lot of times I see it and I explain this to patients. If you ever see someone with a dip in their lower back, we call it like a sway back. But more than likely, their spine, the lumbar spine, is not in proper alignment. All right, and as a result, those muscles, those tendons, those ligaments are being stretched to capacity. Now, over time, again, if this is a micro trauma, meaning over time, having the weight carrying it, your body starts to break down. Again, you start to feel pain and or discomfort. All right. So what can I do as a chiropractor? How can I help you? Again, back pain is our thing in a sense that we do spinal adjustments. Spinal adjustment. The point of the spinal adjustment is to place your body in the best position so that it can heal naturally. All right. And to rely on the body's natural innate ability to heal. All right. So as a result, you're going to move better. You're going to feel better. And guess what? You're not going to perceive any pain because your body is functioning optimally. What you can do is maintain a healthy weight for your body frame. Okay. I'm not a big fan of the BMI. I believe that it has some inaccuracies in it, if you will. However, I believe that you have to have a good weight that is proportional to your body frame and your build. All right. If you need help with that, consult with the doctor, consult with a dietitian and nutritionist to help you get to where your goal weight is. All right. What is healthy for your body and it's not putting not only stress on your back, your muscles, your joints, but also on your internal organs. All right. The other thing would be to, if you are working in a position where you're standing a lot, or you're sitting a lot in one stationary position, is to, one, if you're standing, to put a little box under the foot to sort of take pressure off your lower back. It helps your back to flatten out and reduces some fatigue off your back, gives your back sort of a break. If you are sitting, then make sure that you are at 90-degree angles. And what does this mean? It means that when you're sitting, your feet should be flat on the floor and your knee should be at a 90-degree angle and your hips should be at a 90-degree angle. All right. This takes unnecessary pressure off of your lower back and your hips area. So again, I'll put a picture so you can get sort of a visual, and I'll eventually give you some exercises and some other videos what you could do. All right. And the most important thing would be to get help. All right. If you have back pain more than 5 days, and you're eating medicine, and you're drinking medicine, doing whatever you do to get the medicine in your body, and it is not working, go get help, preferably from a chiropractor. Why? Because this is what we see all day, every day. We are experts. This is what we do. We study the relationship between the nervous system, the muscle system, and the skeletal system, and how this system all works together. And through the spinal adjustments, the idea, again, is to place your body in the best position so that you can heal naturally without the interference of medicine, without the interference of drugs or anything of that nature. All right. Again, this is what we do all day, every day. A great chiropractor will not only adjust you, but it will give you exercises to help reprogram and restart your body. What does that mean? It means if your body has adopted an abnormal position for years, all right, because you have pain, what happens is people have a tendency to move away from pain. So if it hurts for you to stand up tall, then you would just lean forward slightly, which in turn will put unnecessary stress over time on your body, which eventually will accelerate your risk of obtaining osteoarthritis or spinal degeneration. All right. Spinal degeneration does not come from nowhere. It is a result of trauma, misalignment of the back and things of that nature, misalignment of the joints. All right. So again, go see your chiropractor. If you're in the DMV area, Baltimore metropolitan area, and you're looking for an amazing doctor who's very passionate about helping people, then give your girl a call. All right. Give me a call. I'll put my information at the end of the video. I'm always accepting new patients to see how I can help you. All right. If you're not in the DMV area or Baltimore metropolitan area, that's unfortunate. But seek out a chiropractor in your area that's willing to help you. Again, not only to deliver the specific spinal adjustment, but to give you rehabilitation type of exercises to retrain the brain and strengthen the body. All right. So that's all I have for you today. If you like the video, hit like. Feel free to leave a comment down below. Share it and subscribe. If there's any health topic you would like for me to adjust, I am welcome to talk about all things related to health because I love talking about health. It's like one of my favorite things to talk about. Go on and on and on and on. Then go ahead and put a comment down below. I'm very open to talk about that. All right, so the next joints I'm going to hit is the pelvic area and sacrum area, which is very common complaint for a lot of individuals. Again, don't forget to hit like, comment, subscribe, and share. As always, remember that a healthy mind and healthy body creates a healthy life. Until next time, stay healthy.